Welcome back. Several new developments on the coronavirus as new cases continue to rise. We're joined live by Dr. Jeff Pothof of UW Health this afternoon. Thanks for being with us, Doctor. Let's start by asking about Milwaukee County. We're talking about new cases being on the rise, and we're now in the yellow per CDC guidelines. So what exactly does that mean? And is there any indication that we may return to green anytime soon?
Right. So there's a couple things that go into these new community level rankings. The thing that would most likely turn you from green to yellow is either a significant increase in cases, so more people having COVID-19, or increased strain on your healthcare system there in Milwaukee County, number of staffed beds, room for people who come down with severe COVID. If we wanted to get back to green, the best way to do that would be to decrease the number of people who are coming down with COVID-19. The harder way to do that would be to increase resources at those hospitals. But I think we will see more counties turn yellow in the coming weeks as cases climb.
Why do you think we're seeing a surge in cases right now? I hesitate to use the word surge because that's a lot, but more cases right now. Is it because of the new subvariant of COVID, or is it BA2? What is it?
Yeah, for right now in the United States, it's this subvariant of Omicron called BA2, and it's more contagious than the original Omicron variant. Folks who didn't get Omicron in the first wave or had it and their immunity is waning, people who are vaccinated but their immunity is waning, they are likely to come down with symptoms when exposed to these super contagious variants. Now, those who are vaccinated, boosted, those who've recently been infected aren't likely to get very sick, which is good news, but they will have some symptoms with these much more contagious variants.
The FDA has restricted the Johnson & Johnson vaccine because of blood clot concerns. Who's still able to get this vaccine? And should people who have already gotten that vaccine be concerned?
Yeah, folks who've already gotten it back when we were first giving vaccines, they don't have much reason to be concerned. The risk for blood clot in the Johnson & Johnson vaccine, we knew about it shortly after it came out. For a while, it was even paused. That risk is exceedingly low. But what we know right now is that that risk isn't there with the Moderna or Pfizer vaccine. The Moderna and Pfizer vaccines, especially against these new variants, are a little more effective. So you're best off not getting the Johnson & Johnson vaccine unless for some reason you can't get Moderna or Pfizer. That might be an allergy or something like that. So most people are going to be getting Moderna and Pfizer. Very few people will be getting the Johnson & Johnson going forward.
One last question before we go. Some people have received their second booster, particularly those that are older than 60, and people over 50 are eligible for it. Do you see that being widened at any point where people younger than 50 can get a fourth shot?
I do. So I think sometime in July, we will likely get some guidance from the CDC on future booster strategy, especially in light of people who are currently boosted under that 50-year range, getting a little bit long in the tooth on the distance between their booster and where they are right now. I think we'll see some widening of those booster requirements, probably sometime late summer, fall, folks being eligible for another COVID booster just in time to get their flu shot at the same time.
All right, Dr. Jeff Pothof with UW Health. As always, we appreciate your insight into this subject. Have a great day. And a reminder for you at home, you can always find the latest information on the pandemic, including information about boosters and how to get tested at tmj4.com/coronavirus.